koutou e hoa ma, nau mai, haere mai, kake mai, piki mai. Kia ora, Melissa, ko Chan toku ingoa, he te kuta aho.
Kia ora koutou, ko Melissa aho. My name is Mel. I'm also one of the doctors working here at KMC.
So Melissa, winter's here.
Yep.
And we're getting swamped and smashed, as a lot of health professionals are, whether they're in primary care or secondary care. And so we thought we'd do a video.
Yeah, that's right. So I mean, we've had a couple of years of closed borders, everybody wearing masks, distancing, keeping away from others, and so we've really kind of, as you say, been smashed this year with winter illnesses, not just COVID, but flu. We'll start to see RSV, all sorts of things coming around. And understandably, with the kind of past couple of years in COVID, we're seeing a lot of anxiety from people about getting sick and wanting to get help and wanting reassurance for illness. So that was the thinking behind making a bit of a video to help empower people to kind of manage safely at home and what things to look out for and what things we'd love to hear from you about, because we are still here and we do still want to care for you. So, I mean, there's a whole bunch of viruses really that can cause things like the common cold. I mean, we've obviously heard a lot about COVID over the past couple of years. There's also things like the influenza virus. We had that trouble with RSV last year as well. And there's all sorts of them really. And the main thing is that they all can cause very similar symptoms, but it's a real spectrum. Some can be pretty minor. Some can obviously be pretty severe and pretty scary. But it's more about kind of sharing information with you guys about what to look out for, how to manage, and kind of where to go from there.
That's right, and if we think about it, unfortunately we're in a perfect storm, aren't we?
Yeah. Yep.
With winter upon us and 2 or 3 years where everybody was doing the right thing. They were isolating, physical distancing, not going into work. And we saw as a result of that, the number of cases of COVID went right down, and also no cases of flu. And as a result of 2 or 3 years like that, the general community have got no herd immunity to all these viruses. And now, winter is here, people are gathering inside, and the virus is spreading. All these viruses are spreading because there is no immunity.
So we can think about things like blocked nose, runny nose. Sometimes we have a bit of a sore throat,
That's right.
a cough. We can have some headaches and kind of generally feeling a bit tired and achy. Sometimes people get sinus congestion. Sometimes people get fevers.
Runny noses.
Of course, yeah. These are all really, really common symptoms that can happen with kind of the common cold and flu-like illnesses.
So Melissa, we know that most of these viral infections can last anything from 2 or 3 days to sometimes a week to 10 days. Some can be mild, some can be more severe, so there is a spectrum. What should we be asking people to do at home to manage these symptoms?
Yeah, so look, the main thing when managing these kinds of infections at home is really all about what we call conservative measures. So it's all about kind of supporting your body to fight the virus, and it's all about managing symptoms. The most important one I tell my patients is to rest.
Very good. Yeah.
Really important to take it easy. Your body is trying to fight an infection, so rest and give your body time to do that.
Don't sweat it out.
Don't try to push through. There's a lot of pressure to work and do all sorts of things. Just take it easy, rest. It's really important. Other things I say are really, really important, so keeping up your fluids. Often when you're fighting an infection, your body can burn through more fluids as well, so it's super important to stay hydrated and make sure that your body is in its best position to kind of fight the virus too.
Medications?
Yeah, so other things we tend to think about that can be helpful, simple pain relief, Panadol, Brufen, those kinds of things are also, really helpful to kind of help manage some symptoms. Other things that can be helpful, cough and cold medication can be helpful. Lozenges.
Grandma's old recipe.
Yeah, lemon, honey, ginger.
That's right.
Throat sprays, nasal sprays, those sorts of things can all be really helpful just to manage symptoms, make things a little bit more manageable, as I say, and kind of help your body to support it, get through the virus and fighting things. The thing with antibiotics is that they're there for bacterial infections, which is not what the common cold is. The common cold is a virus. Antibiotics will not help.
flu is a virus, RSV is a virus,
Yeah.
COVID is a virus.
They're all viruses. Antibiotics won't help them. And so actually the thing that we worry about with kind of giving antibiotics unnecessarily is, as you rightly say, is contributing to resistance and generating superbugs that are resistant to the antibiotics that we use, and we already are seeing that happening in parts of the world. So that's really important for us to try and avoid.
That's true. And what about the patients who say, well, I've got a coloured discharge or a green snot or green phlegm? What should we be saying? What should we say to them?
Really good point. So you do find in a kind of common cold or a viral infection, it is pretty common towards the end of it actually for things like nasal discharge and snot to turn a green colour.
That's right.
That often means the virus is actually making its way out of your body and doesn't necessarily mean a bacterial infection. So actually it's a good sign, and it's not a reason to think about antibiotics at that time. Yeah.
No, I know you're right, and things have changed because when I was at med school
Yeah.
a long time ago, a green discharge did mean there was bacteria there. But in fact, it was a New Zealand study from Otago which showed that all these snotty, green-coloured discharges were all viral. So the body needs a temperature. Our immune system needs a temperature to fight bacteria or viruses. And sometimes we get so obsessed with reducing temperatures, and that's not what really we need. We need to allow the body to have that temperature. Now I can think of a scenario I always use, and you'll forgive me, Melissa. Let's say, because I love science fiction, let's say in the alternate parallel universe there are two Melissas, and one has no temperature but is really unwell, on the bed, tired, not eating, not drinking, maybe vomiting. And then you've got the other Melissa in the parallel universe who's got a temperature of, let's say, 38.5, but is up and around, is active and doing things that she normally would on that day. I'm more worried about the first Melissa, despite the fact that her temperature is low. It is really important that you realise we are here to help.
Yeah.
And if at the end of the day you want our help, please do contact us. Certainly the red flags we talked about are things like people who are really lethargic, can't get out of bed, perhaps they're not eating or drinking.
Yeah.
Maybe they've got a very high temperature, and by that I mean something over 39 degrees, 38.5, 39 degrees. Unusual rashes, vomiting. Those are things that I would be concerned about, or all doctors would be concerned about. Of course, for parents, if you've got children less than a year or 18 months, trust your intuition. You know your child better than anybody else, and if you feel there's something wrong, please contact us. Don't wait, that is really important. And I guess these days a lot of people have saturation monitors.
Yeah, true. Yeah.
And I think a saturation less than 93, you should be contacting us. And certainly people with fast, rapid breathing, especially kids with fast, rapid breathing who look distressed, that's a must. You must please contact us. What else, Melissa?
Yeah, I think the only other thing I would add, you kind of touched on it all really, but it's all about if you're not able to kind of do the things we would want you to do to manage those symptoms at home. So if you're not able to keep your fluids up, you know, adults or children, if you feel that you are getting dehydrated or your child is getting dehydrated, or as you rightly say, troubles with breathing, of course, we would always want to hear from people who are experiencing that.
So, mā te wā, ka kite anō, look after yourselves.
And remember that we are still here and we're here to help.